Hi, this is Mariam Shodro. I'm going to do the health assessment head to toe. This is my patient, my sister, this is our room and everything. Okay, thank you. I apply hand hygiene and I also wipe my stethoscope before going to the patient room. Hi, Mrs. Mary, how are you?
Hi, good.
I am Mariam Shodro. I'm your nurse today.
I am Mehri Puranhaji.
Can I take your ID band? Check your ID band. Would you please tell me your name and last name and date of birth?
Mehri Puranhaji. April 7, 1970.
Okay, that's great. Thank you so much. Do you need to go to washroom?
No.
Are you comfortable?
Yes.
Okay, let me provide some privacy for you. I'm going to do a health assessment on you, and I would need to do some palpation. Is it okay if I touch you?
I'm okay. Yes.
Perfect. So my patient appears her stated age. Her skin is moist and intact. The hygiene is good. There is no odor, and her height and weight are also according proper for her age. And she is well nourished, she is well dressed and groomed for the setting, and she also talks very fluent and she understands very well. And what I can also say is that she behaves very well, she has a good mood, and she has a good facial expression. And would you please take a walk for me?
Yes.
Thank you. My patient walks very well, relaxed and well balanced, and the gait wide is as the shoulder width, and the range of motion of the joints were to the fullest for the walking. You can see that she can move them to the fullest. Okay, so who are you?
I'm Mary.
Where are you?
Hospital.
Okay, and what day is today?
Monday.
Monday. Okay, so she's alert and oriented to the time, person, and place. Okay, so now I also continue with your head. So the head is normocephalic. There is no lesion. There is no lump. I don't see any deformities. It is in the midline of the body. The posture is erect. So I palpate. Do you have any pain?
No.
Okay, no pain. There is no tenderness, no lump, no swelling, no scar, and the hair is distributed well on the skull, and there is no foreign body, there is no dandruff, the hygiene is well, the texture is smooth. And okay, that's great. So now I would like to check your ears, and or let's go to the face before going to the ears. So what I see in the face is that the parts are equal, and the eyebrows are symmetric, the eye is symmetric, the face is symmetric, there is no tics, there is no involuntary movement, there is no deformities, the skin is moist and intact, it is warm to touch, and there is no lesion or scar. And would you please smile, frown, frown, lift your eyes, okay, and close your eyes tightly, don't let me to open it. Perfect. Can you puff? Okay, that's great. So now I can say that cranial number 7 is intact for the face. Okay, now we do eyes. For the eyes, I see that the eyebrows are distributed well, the eyelashes are distributed well, it is symmetric and equal, and there is no lid lag, there is no strabismus, there is no drainage. Can you look up for me? Look up. Okay, conjunctiva is pink and nice. The sclera is white and bright. There is no drainage. There is no redness, erythema, or discoloration, or a yellow. Okay, now I would like to do a test for your cranial number 2, which is optic. I would like to test your optic. Would you please read this line for me?
HOID.
Okay.
Up,
Mm-hmm.
down,
Mm-hmm.
right,
Okay.
left.
Perfect. So I can say that your vision is 20 out of 20. And that is for number 2, cranial number 2 for the optic. Yes. And now I would like to check the accommodation. For accommodation, I sit in front of my patient. Sorry, for confrontation, for the test confrontation, I sit in front of my patient. Will you please cover one of your eyes? Okay. And look at me. Look at me. Yes. When you see my fingers, just say now.
2.
No. Just say now. Now.
No. 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 Now.
Okay. And the other eye? Look at me.
Now. 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 Now.
Okay, that's great. So the confrontation test is good, is intact. The optic is good. And now I do the accommodation, and I check the pupils if they are responsive to the light and accommodation. Would you please look into the wall, to an object into the wall? Thank you. I'll bring a light to your eyes. Just look into an object. Okay, very good. Okay, so both pupils are reactive to the light and accommodation. Would you please look at the object? Okay, and then follow the pen. Okay, both reactive to the light and accommodation. And the pupils are 4 millimeters, and they constrict from 4 to 3. So I can say that the pupils are equal, round, and reactive to the light and accommodation, parallel. So the cranial, and one more thing for the cardinal gaze 6, please just follow the pen without moving your head. Without moving your head. Look at me. No. Negative. Okay, the cardinal gaze 6 position is intact. There is no involuntary movements, and I can document that. Okay, so we did that for the eyes, and now we do the ears. For the ears, what I see is that the ears are equal in size bilaterally. There is no swelling, there is no redness out around the ears, and there is no deformities. When I touch the tragus, pinna, and master, do you have any pain?
No.
Okay, there's no pain, there is no tenderness. Now I do a test, a whisper test. I say 3 words, and I would like you to repeat.
Classroom. Chocolate. Basketball. Volleyball. Football. Classroom.
Okay, that's great. So I can say that hearing is equal in both ears. Now I would like to use my otoscope for to test to see the external auditory canal. Okay, I take the pinna up and out, and I see inside. So what I see is that the external auditory canal is pink and moist. There is no erosion, there is no redness, and the tympanic membrane is gray, pearly gray, and there is no bulge, and there is no redness. Okay, so also there is no odor, there is no discharge, and it is clean and nice. I do the same for the other ear. I just don't have, because we don't have so much time. Now I clean my hands, and I do the nose and sinuses. What I see is that nose is symmetric, and I need a light. I just use some light. Would you please tilt up your head? Thank you. No, just the nose. Okay. So what I see is that the nasal terminates are pink and moist. The sputum is in the midline. There is no perforation, there is no nasal polyps, and there is no discharge, there is no odor. And okay, I would like to do a test. Would you please block one of your nostrils? Block it. Okay, and sniff. Okay, the other one. And a sniff. Okay, so the patency of the nose is good. Now we do a test for the smell test. Tell me what you smell. Would you please block one of your nostrils? Close your eyes. Close your eyes. Tell me what you smell. Close your eyes. Close your eyes. Close your eyes. What do you smell?
Coffee.
Okay, and the other one? Do you smell? Do you smell?
Coffee.
Okay, great. So the smell and patency of the nose is intact, and we can say that the cranial number 1 is intact. And now I would like to palpate the sinuses. For the frontal sinus, do you feel any pain?
No.
No. And the maxillary sinus, do you feel any pain?
No.
Okay, so the frontal sinus and the maxillary sinus, there is no pain and there is no tenderness. Okay, now I do the mouth, and what I see is that the lips are symmetric. There is no deformities, there is no involuntary movement, no tremors, and there is no cyanosis, there is no cracks, and it is moist. And would you please say E?
E.
Okay. Say E.
E.
Okay, what I see is that the teeth are white and nice. There is no dental caries. The gums, there is no bleeding. The gums are pink. Would you please say A?
A.
Okay, I see uvula is in the midline. It also rises with the soft palate. I see the hard palate a little bit pinkish. Can I see? Okay, I see the subpalate pink and nice. I see the tonsils. The tonsils are 2+ and they are pink. Okay, would you please stick out your tongue? Okay, the tongue is pink and there is no thrush. There is no, it's not white, it is pink. There is no deviation, and there's no tremors. There's no deformities. Would you please read right to left? Thank you. And would you please say tight?
Tight.
Light?
Light.
Dynamite.
Dynamite.
Okay, so I can say cranial number 9, 10, and 12 are intact. Okay, now that we did this, and there was no tremors for that, so we do the neck. What I see in the neck is that neck is in the midline. There is no lesion, there is no scars. Would you please take this off? Thank you so much.
Yeah.
Just take it off. There's no lesion, there is no scars, there is no thyroid enlargement, there is no masses, and the trachea is in the midline. Okay, now I would like to palpate your carotid. Okay, the carotid artery is 3+, and it is strong, it is hollow, and it is regular at both sides. Okay, so now with the upper extremities, and I said about thyroid that there is no enlargement. With the upper extremities, I see that there's no deformities, there is no lesion or scars. It is bilaterally equal, and the body parts, it is symmetrical, and okay, there is no swelling. And do you have any pain?
No.
Okay, no pain, no tenderness. With the joint, there is no swelling, there is no hot or cold, it is warm to touch, there is no lesion, there is no scar. And okay, would you please grip my hands? Grip my hands, thank you. And I would like to palpate I just need my watch here, and I would like to palpate your radial pulse. I also use my watch here and palpate. Okay, so the radial pulse is equal, is present, it is regular, it is 2+, and it is 63. Okay, thank you so much. And so now I would like to do the lower extremity. I do the range of motion as well before we go to the lower extremities. Would you please stand up? Yeah, thank you so much. What I see here is that anterior, posterior to the transverse ratio is 1:2, which is normal. And with the hands at your side, would you please bring them up like this? Flex, okay, I mean, extend, flexion, flexion, extension, extension. Okay, now go to abduction, abduction, like this, and adduction, adduction. Very good. Okay, for the elbows, flexion, flexion, and extension. Okay, that's great. And like this, external rotation, like this, internal rotation. Thank you so much. And okay, and for the wrist, up, down, okay, in the middle, like this, okay, pronation, supination, very good, and radial, like this, like me, radial deviation, ulnar deviation. Okay, just the fingers, up, up, fingers up, fingers down, fingers down. Thank you so much. So the range, you can sit down. The range of motion is intact, is good. And now we do no, thank you. We do the lower extremities. For the lower extremities, again, what I see is that everything is intact and there is no lesion, there is no scar, the skin is intact, and there is no deformities, there is no joint swelling, and no. Do you have any pain?
No.
No pain, no tenderness. It is warm to touch, not cold or hot. Okay, I would like to check your dorsalis pedis. So the dorsalis pedis both are present, they are equal and strong. And now I would like to check your posterior tibialis pulse. For the posterior tibialis also they are present and strong and equal. Okay, now I would like to do a dorsiflex. Okay, just like this, dorsiflex, flex, flex, like this, and then like this, very good. And then push my hands. Okay, that's great. So the strength is good. Dorsiflexion and plantar flexion are equal and strong bilaterally. Now I wash my hands again. Okay. So after this, I go to thorax. What I see is that, and the thorax, there's no deformities, there is no abnormalities, there is no respiratory distress, there is no muscle, accessory muscle used. But I would like to check your posterior thorax. Would you please sit here? Thank you so much. For the posterior thorax, again, what I see is that there is no lesion, no scars, no deformities. It is bilaterally equal, it is symmetric. And now I would like to palpate. Do you have any pain?
No.
No pain, no swelling, no mass, no lumps, and everything feels right here, and scapula and everything. Okay, now I would like to percuss. For percuss, I use the middle hand and I start with the apex of the lungs. I try not to do it on the scalp because it is dull, so I need to hear a resonant and bilaterally equal sound, and I go intercostals. Okay, so I can say that this is bilateral. There is And now to check if there is any whistles or broods and crackles, I use my stethoscope to auscultate. And I start with the apex for the bronchial sounds. Would you please take a deep breath? Just take a deep breath. Take a deep breath. Okay. So I can say that that there is no brood, there's no crackles, there's no wheezes, and it is equal. The air enters the lobes equal in both sides, in both of the right and left lobes, and so that's for that. And for the anterior, I would like to also check the respiration, and I use my watch. Just breathe. So in 1 minute, the respiration is 17. It is normal, it is relaxed, and yeah, the rhythm and everything is fine. Okay, thank you so much. So now I would like to check your heart. For the heart, I need to listen to auscultate 5 points. So from the sternal notch, I go to the angle Lewis, and from angle Lewis, I go to right. In the intercostal second, I find aortic area, and then I listen to aortic area. After that, I listen to pulmonary area, Erb's point, and in the intercostal 3, and then intercostal 5, I listen to tricuspid, and in the mid of clavicula, I listen to mitral, and that is where I can also count the apical pulse. So, and I also listen to S1, S2, lobbed up, and check for which one is louder, and I also check for S3 and S4 if I hear any. Okay. So I hear lobbed up. I heard lobbed up, S1 in the aortic is S2, dub is louder than S1, the same as pulmonary is S2 is louder than S1, but in the Erbs they're both equal, and tricuspid and mitral is S1 is louder than S2. I didn't